scar management, what do you do? Before we get this question, does it hurt?
No, it feels nice, right?
It feels good.
You don't realize you need it, but when you start it, it feels like what your body wants. The problem is, especially with abdominal surgery, is there is about a 95% chance of getting, you don't really know what it's sticking to, and it can stick to lots of things because it kind of branches out. So women always say, is it going to fall out? I have patients who will come to me, and when we're talking about things, they'll say, I'm here for back pain, and it could be coming from my scar. And then we talk about bowel function, bladder function, and they'll say, oh, I get a bit bloated and I'm a bit constipated. And actually, halfway through treating the scar, they'll say,
She's an Ed Sheeran fan.
The club isn't the best.
Yes, I'm loud as usual. Please hop in. Thank you, Laura. Welcome to Hop In.
thank you for having me.
This is gonna be fun.
Yes.
An Ed Sheeran fan, huh?
Ed Sheeran fan, always Ed Sheeran.
She just told me about the concert. I might be going.
Couple of weeks time.
We're like here promoting Ed Sheeran.
Well, is his new song out? I mean, we're on track.
Yeah. We're so relevant.
We're so relevant.
Let's go. Laura, so excited about this discussion because I am your patient.
You are my patient.
I am your patient, so this
And
is
friend.
and friend and business partner.
Yeah.
Actually, because that works that way. You
Does,
know,
certainly does.
it's our clients both need us, and I love that. I love this relationship. We're hopping in, we're going on, and see you in a bit. Okay, real close for safety. Before we even go anywhere, who is Laura? What does Laura do? Ooh.
So, well, the official is I'm a women's health therapist who has become a scar therapist in the last couple of years. And I mean, I'm old. I've been a women's health physio for over 20 years now. And I love women's health. I'm passionate about antenatal, postnatal care. But I decided a few years ago, so 14 years ago, some people know this about me, some people don't. 14 years ago, I got diagnosed with stage 3 bowel cancer. I had to have part of my bowel removed. I had 6 months of chemotherapy, so I am covered in scars in my abdomen. And then I went on, luckily, to have my 2 kids, which was an elective C-section for both, so I have C-section scars as well. And for a couple of years, I didn't touch my scars. And as a physio, we're not really trained in scar therapy. When we do these courses, we do little bits of
here and there,
but nothing major.
Nothing.
And
there's no training called scar management anyways.
No.
Yeah.
So I was getting on with life, and then I actually went on the Mummy MOT practitioner course, and we were practicing some exercises and doing some breathing techniques, and the instructor said to me, what's wrong? Can't you breathe properly? And I said, what do you mean I can't breathe properly?
Look at me.
Yeah.
I'm a perfect breather.
She said, no, what's going on? Like, let me see your abdomen. I lifted up my top, and she was like, whoa, have you looked at these scars? And I'm like, well, no, like, no. And so that kind of got me thinking, and I was living in the UK at this time, and we moved to Dubai, and I looked up Jocelyn, who's a great scar therapist, a physiotherapist, and I was like, Jocelyn, can you help me? Can we do something with this? And she started doing some scar therapy with me, and I was like, this is what I'm meant to be doing.
Okay.
And so that's kind of where the journey began. I then went back to the UK, and I trained in scar therapy a couple of years ago, and I'm continuously doing online training with them. But it's what I'm passionate about, and there aren't many people in Dubai doing scar therapy. No. And I love all scars. Now, obviously, being a women's health physio, I'm mainly seeing C-section scars, mastectomy scars, but particularly abdominal scars is what I'm passionate about. I do have a couple of patients who are in a similar situation to I was 14 years ago, bowel cancer, and even appendectomy. So when people have had their appendix removed, these scars, especially if they're older, they were big. And so anything in the abdomen, I love.
Okay.
So I'm a women's health physio, a Mummy MOT practitioner, and then more recently, a scar therapist.
Wow. So here's how we met. Okay. I was starting to get my certifications and everything, and a while in between I did the fascia course in San Diego. I really want to go back. It was
I like
nice.
San Diego.
And I started to learn a little bit about fascia, how we store stuff in there, and we'll talk about this. And I'm like, okay. And then I came back and I understood that relationship a little bit more. And then I was constantly trying to work on my teaser.
Mm-hmm.
And, you know, to train people, you also need to kind of, you know, get yourself up to speed. And I'm not, you know, I'm a good mover. It's just that I haven't been in personally training people forever, so I work extra hard, by the way, to kind of get myself up to speed in the industry. And I never got the teaser right. And every time I did pull it through, I knew my back was taking everything.
Yeah.
And at some point, because I was so stubborn, I wanted to get it done, my back would actually hurt after. So my back would hurt after every training. So every time I go for a 3-4 day training, I come back, because it's intensive. It's like those 5, 6, 7 hours of you moving and trying to you moves, and you're not exactly aware every time and warmed up, right? So every time I go to a training, my back would act up, and I'll be at home for like a week, and I'm like, I think
there's an issue.
I think it's the 6 surgeries I've had in my life. I just think, you know. and they're all around the abdominal.
Yep.
And 2 out of which are C-sections. I'm like, and I started, I mean, and I knew you from before, right? We obviously did Genesis, my core stuff, but I'm like, I saw some posts about scars, and I'm like, okay, that's it, I'm going. And oh my God, look at my teaser now. Full credit to Laura. Laura. So my actual Pilates teacher is Laura.
Handy.
Yeah, and you're Laura, and then Dina helps me all the time with getting better as well. So there's a group of people that have exactly. And yeah, this is how bad it was.
But that's what it's about, right? That is about the team of people that all have their own speciality, that are bringing something to the mix, that allow people to do what they want to do.
What they want to do. Yeah, exactly.
That's what we're all here for.
Absolutely. And then because, you know, we think, oh yeah, it's okay if my back pulls, I'll push through. And that's how I thought. Maybe I'll get stronger. Yeah. And then
I just need to practice more. It'll get stronger, it'll get less painful.
Exactly. And that's exactly how everybody I meet today, not everybody, but probably 95% of people that I meet at the studio are thinking the only thing I need to do is Pilates or gym or whatever, right? But the only thing I need to do is move, and then it'll all, you know, get sorted.
And what I think is really sad in that situation is people have made the right step in choosing Pilates and choosing a hobby, and they're trying to get stronger, they're trying to get fitter, they're trying to do it, but they're not sure, or they don't know why they're not
getting there,
and then they give up. And I get that, right? Because you commit to something, you give it your all, and you're still in pain, or you still can't move, and then you're like, oh, what's the point? And the problem is there's no awareness about any of the stuff I do. Nobody
tells people who walk into the door, oh, look at you. Yeah, apart from me, thank you. I'm like, no, you don't need me, honey. You need a lot of other things, you know? And that's, so we actually say it, and not everybody takes it seriously, which is even more sadder. Because they think, whatever, I don't know what they think, but again, I know what they think, and Dubai being sometimes a bit too commercial, they think, oh my God, you know, they want to send me whatever to make more money. It's unfortunate that people are very conditioned to that thought, but again, eventually when they get to know you, when they get to know me, they think, okay, no, that's a genuine help that I'm getting, which is very good. But yeah, we tell them, and we say, you need either Laura, or you need this, and you need that. Many times, I'm very happy that many times now they're more open about exploring with these other things. So, scar management. What do you do? What do you actually do?
So what are we doing? So scar therapy is about the assessment and treatment of a scar. And why are we doing it? Well, we're trying to improve the mechanical and physical properties of the scar by influencing the scar maturation process. And we're doing that because we're trying to promote healing. We're trying to reduce the risk of long-term complications. We want to improve the appearance. We want to improve the function. We want to get the sensitivity back to normal. And also, really importantly, we want to aid the emotional recovery, the trauma that's often linked to so many of our scars. Yeah. So scar therapy can help with all of that. And it's a combination of treatments. So there will be, after the assessment, there will be some form of manual scar therapy, different techniques depending on what I find or the type of scar. There's also then the education, teaching people what they can do at home. Does it need to be a massage technique? Do they need to be using silicone? Do they need to be using oils or creams? So giving them their self-care. Rose hip oil is my go-to. I mean,
I don't stop this.
No.
Like I now use it more than
honestly, you can use it all over, exactly.
It's
and it's great
beautiful.
for stretch marks as well.
Yeah, oh my god.
But I mean, for example, like silicone, definitely with the C-section scars, silicone is kind of the gold standard in the first couple of months. So silicone is great at keeping in the hydration. Scars are all about needing the hydration. And it's giving people the other advice as well. So we're talking about hydration. We've got to be able to keep the moisture into the scar. Silicone strips are great at doing that, but you've got to have the hydration in your body to start with.
Yeah.
So you need to be drinking your 2 liters, 3 liters, more if you're breastfeeding. And also things like sun care, because scars are really sensitive for definitely the first 2 years. So you need to be putting your factor 50. Even if you're wearing a swimming costume, you need to be putting on your factor 50 underneath to protect that scar. So it's about the treatment, the advice, the self-management. And then I don't just do manual therapy. I'd often do soft cupping, show patients how to buy soft cups themselves and use it. Stretching, movement, exercise. And I obviously have a lymphatic machine, which is a machine that uses the negative pressure to suction and lift. So if a scar is really pinned down.
Before we get this question, does it hurt?
No, it feels nice, right?
It feels good.
I've done it on my own C-section scar. It's a lifting, tugging action, but actually, and people say this to me all the time, you don't realize you need it, but when you start it, it feels like what your body wants. Yeah. Because it's lifting, and often so often with massage techniques, we're actually compressing. And what the scar wants is is
to pull it off. Yeah.
And sometimes I can do that with my hands. Sometimes it's deeper and firmer and I need to use the lymphatic before I can use my hands. And most of the time I think it's a nice combination to do the two together. It also sounds like a breast pump machine.
Yeah.
Like
that's exactly. Yeah. So it looks like one actually, because it has this, oh my god.
and actually I've had a patient who, I don't advise this at home, but I had a patient who said to me her husband is an engineer and they adapted her breast pump. It was not as good as my lymphatic, but she adjusted her breast pump to give her a little something at home.
Yeah.
But I mean, people often will shut their eyes, they feel very relaxed.
Yeah.
And also I think if there is this disconnect with the scar and people are a bit icky about me touching it, it's that separation between me and them as well. It gives them, it's something else that it doesn't feel quite so personal over a very personal area.
Yeah.
So yeah, that's kind of the treatment as a whole.
When I came to you, I had my last operation, C-section scar, 5.5 years ago. Mm-hmm. Is there a certain time and duration after a scar that we should see you or manage the scar or treat the scar? Like, how does it work from a timeline? Oh, as soon as I have a scar, I treat it, or how does it work?
Okay, so I definitely don't like to touch scars before 6 weeks. There are some doctors, particularly orthopedic doctors, that like scars treated earlier, but in terms of the training I've done, it's 6 weeks. So 6 to 8 weeks is normally when I'd say to somebody who's had a C-section or has had any abdominal surgery, come and see me at 6 to 8 weeks. We need it to heal, right? We don't want to be too disruptive. The body has an inflammatory response in those early days, which is necessary for the scar to heal and to form. But if we aggravate that more and cause more inflammation, we worsen the scar.
Yeah.
So we do need the body to have done its natural inflammatory stage and be going into its remodeling. Now, a scar will remodel for up to 2 years.
Okay.
So it's easier for me to treat the earlier the possible, and definitely within the 2 years is easier because your body is still in that stage.
Still in that stage.
But no, I mean, I've treated scars 30, 40 years down the line. Sometimes I often say to people with older scars, okay, this might just take us a little bit longer because there's more scar tissue and you've adapted around the scar, and then it will surprise me, and in 3 sessions I'm like, wow, this has done so good.
And they've reacted very well.
Yeah, exactly. They've reacted really well to it. So there isn't a time limit. I think the only issue with time is you have compensated.
Yeah.
And what has compensated? Have you affected the organs inside? Have you caused back problems? Have you moved differently?
Yeah.
Have you affected your overall?
Have you lifted your left hip up? For me, it's my hip that just goes up. It has a brain of its own.
But you're never too late. But ideally, 6 to 8 weeks to start the process is the best time. But yeah, never too late.
That's very comforting, because people think, oh, it's been 10 years, how bad this can be. Oh, my body should have healed. Like,
and it is healed, right?
Yeah.
This is the thing.
It's in its own way.
Yeah, it's healed. The problem is, especially with abdominal surgery, is there is about a 95% chance of getting scar adhesions. Now, adhesions are the body's response to the inflammatory process, and it's when you get bands of scar tissue forming between 2 structures that aren't normally attached. So this is really what we're dealing with in scar therapy in terms of function and pain and resistance, is that these scar adhesions are there. And it, like I say, it's such a high chance in the abdomen, and we don't really know what it's sticking to, and it can stick to lots of things because it kind of branches out. But under that C-section scar, for example, you've got the bladder, you've got the ovaries, you've got the uterus, you've got the fallopian tubes, you've got the bowel. So the scar tissue is definitely attaching to the fascia because it's right there. It's potentially attaching to the muscles, but it can be going into these organs as well.
Yeah.
And this is the long-term problems of scars. So what was happening with my scar, and I saw Jocelyn 10 years after my surgery, and my scar got better. But due to the fascial restrictions, I was actually finding it difficult to expand and to breathe.
So it's just holding together.
But I have patients who will come to me, and when we're talking about things, they'll say, I'm here for back pain, and it could be coming from my scar. And then we talk about bowel function, bladder function, and they'll say, oh, I get a bit bloated and I'm a bit constipated. And actually, halfway through treating the scar, they'll say, oh, I'm not getting that anymore. I can now go to the toilet every day and I'm not getting bloated. So just freeing up those adhesions in that area has allowed our body to move. That, especially in the abdomen, right? We've got so much movement. The gut is constantly moving. And if it's being pinned and trapped and pulled by scar tissue, that is going to influence, and you can get your bloating, you can get your IBS type symptoms. And then in terms of having had a C-section, if we think about any surgery, there's healing and scar tissue at every level they've cut through. Okay.
Yeah.
Now with the C-section, there's also been big trauma to the uterus. They've had to cut through the uterus to get the baby out, and they then repair the uterus, and that has healed. The uterus is really close to the ovaries and fallopian tubes.
Yes.
So people talk about, is there a risk to fertility after a C-section? Research is really difficult, but there potentially could be, because if that scar tissue is attaching onto the fallopian tube,
the fallopian tube,
and it won't be making you infertile, but it could be making things a little bit harder for you, and it could be giving you pelvic pain or heavier periods, or there's so much going on in that area that we need to consider.
You've touched on so many things without giving them a name right now. Okay, so yes, you did say fascia, but there's something called visceral. What is it called?
Visceral mobilization.
Yes. Okay. Thank you. So we did touch on that, I think, with your description. Yeah. But I think people read about visceral mobilization, and what does that even mean? Like for me, it was very hard to say even now. I mean, I know what it does. I've experienced it myself, but what is that? Like, what is that in depth? Probably. Yeah. Like, how does it work? What do you do?
So when I got into scar therapy, it was great. I was helping scars but I was getting a block with the C-sections in particular that were pinned down. So scar therapy is very gentle. It's a gentle technique, but I was feeling like there's something more that I need to be doing to release the deeper adhesions. So I started looking around, I started speaking to people, I started watching, and I decided actually visceral mobilization was the next step I wanted to take. So visceral mobilization is the treatment, gentle treatment of the internal organs and their ligaments and their fascial attachments to make sure they can move and displace and glide as they need to. So for example, when we breathe, in one breathing cycle, our liver moves 3 centimeters.
Oh wow.
Because it has 3 centimeters on every breath. Now that equals 100 kilometers a year our liver is moving. Isn't that crazy?
Oh my God.
100 kilometers a year, roughly.
Okay.
So every breath we take, due to its fascial and ligamentous connections, our liver has to move up and down. So if our liver is restricted through its fascial connection, or it's being pulled in a direction and it can't move with the diaphragm, this is going to alter things. There's going to be tension, there's going to be pain, there's going to be dysfunction. The kidneys, okay, the kidneys, every breathing cycle move 3 to 4 centimeters, and they're linked into the quadratus laborum, our back muscle, which definitely in pregnancy is one of the things I treat the most, and there is also attached to the psoas muscle. So if the kidneys aren't moving, you're having a direct impact on muscles that are really important for the back, could be causing back pain. So there's just so many links in with the internal organs,
and
their
layers,
fascia,
and layers.
And so I went and did the training in London, and it has been an absolute game changer, and it's given me that final piece of the puzzle. So now when I say to people they're having scar therapy, they're always having visceral mobilization as well.
One way or another, there's something.
Because underneath the C-section scar is the peritoneal fascia, which is your abdominal fascia, and like we're saying, that 100% is caught up in all that scar tissue, and that is normally the issue with pinning and the overhang. And releasing the peritoneal fascia is a little bit more uncomfortable. Okay, so scar therapy itself, it's very light, very gentle. If we've got a really deeply pinned scar with a big overhang, we have to release that peritoneal fascia, and that is just a little bit more of a vigorous treatment to actually get that unstuck. But I mean, it all works together, right? The fascial system, the organ, I mean, the fascia interpenetrates and surrounds every single part of our body. Our bones, our muscles, our tendons, our nerve fibers, our vascular bundles. And it is therefore giving us this form and function. And so it's all related. You can't treat one without the other. And as a physio, like I say, it was 20 plus years ago that I trained, and no one ever mentioned the word fascia. Never. I mean, and we do medical dissections where I train
where you actually
London.
go and see it.
So over a year, we do a complete body dissection over the year. And you know what they used to do? They used to say to us, this connective tissue, they didn't even call it fascia, this connective tissue we remove straight off the muscle. Now we look at the muscle and tendons.
Okay.
That's literally how I was taught 20 years ago. And so it wasn't even a word I was using for the first 10 years of being a physio. And then as I was kind of delving more into women's health, and I was looking at prolapse, and I wasn't comfortable with how I was taught to treat prolapse, and I started looking and investigating, and I was like, do you know what, I think prolapse, we were very much taught that it's like building blocks. Like your skeleton is there, they're your building blocks. Everything attaches to the skeleton, and that's how you move. You've got your levers. And actually, if we think about fascia, it's more likely that our bones and our organs are suspended within this fascial system, which is then giving it form, function, but it's one continuous
thing that's going on.
Basically. And everything is within it. So in terms of, like, when I used to describe prolapse to women, I'd be like, oh, your uterus has dropped, and it might come out the opening of your vagina, and then people are like, oh my goodness, like everything's falling out.
Yeah.
And then I was like, but things don't fall out. We do headstands, nothing falls out. We don't get everything falling out of our mouth. We're constantly resisting gravity, so this can't be right. So then when you look at fascia, actually, is a prolapse more to do with the fascial tension has caused, for example, the uterus or the bladder to be displaced, and it's therefore being pulled slightly out of its position, which is then pressing against a maybe lax vaginal wall, which is then giving you a prolapse. So women always say, is it going to fall out? And I'm like, no, nothing is ever going to fall out. Everything is connected. But often with prolapse now, the first thing I'm doing is looking for scars. Is it a perineal scar? Is it a C-section scar? Is it abdominal scar that is actually tensioned the fascia somewhere, which is then pulling and dragging the organ, which is then giving them symptoms? So that's kind of how I started thinking about fascia. Now, it's really hard. Research is terrible with fascia.
Yeah.
A couple of reasons, right? Because the study qualities are poor, because how do we really look at fascia in vivo, in the living human? We really can't, because if you're going to put in a camera to look at, for example, the abdominal fascia, you've changed the environment. As soon as you stick in that camera, you've changed the environment. You've already cut the fascia.
Yeah, exactly.
So you can't look at it very well in a inside in the alive human. And then if we think about the cadaver studies, which is mainly what it's based on, there's no fluid in the body. They've drained the body of fluid. There's no electrical current. There's no movement. So if we're talking about the diaphragm and the liver, we've lost all of that. So how can we then look at the relationships? Because you've lost all the active relationship. So it's a really tricky one. And this is why there's so much debate. There's so many arguments. There's so many schools of thought. But we're also having to slowly break down the anatomy that all medical practitioners have been taught. Yeah. And that's a really hard thing to do.
Exactly.
And it's a scary thing to do.
It's a scary thing to do, to say to people, to humanity, that everything that we've been talking about, there's a little chance that there's a lot of that's wrong. Yeah. Absolutely wrong.
So it's a tricky one. And I think the other aspect is myofascial pain. So if we're saying that fascia is interconnected into the muscles and their tendons and the ligaments and the bones, can you really have a musculoskeletal pain that isn't myofascial pain? Research shows that 30 to 85% of people will have myofascial pain in their life. I kind of argue that maybe that's higher, because every time we get a pain, an injury, we are affecting the fascia, right? Every time we sit badly, we have bad posture, we're affecting the fascia.
And some people argue trauma, emotions, stress, all of that,
and that affects how we move. All of that affects how we move, right?
And it stores in the fascia. It stays there.
So it's a really tricky one. And I think what physios are getting better at now is being less specific about what we're treating. So at university, you're taught this is the joint, you mobilize the joint like this, then you move on to the muscle and you treat the muscle like that. Actually, no, every time we put our hands on a person, or every time we ask them to move, we are working on everything. And so I think as physios, as practitioners, we're all getting better at being a bit like, this is a movement dysfunction, or this is a fascial dysfunction, or this is just a pain issue, but let's just work on moving, correcting, and working on it as a whole, and giving less of a description, which is not what the insurance companies want.
No.
They like a diagnosis.
Oh no, right? they like the symptoms, and we need to treat the symptoms and give them those drugs and maybe a surgery. That's ideal, right? But
and also, like we've talked about before, if somebody's had say a back pain for many years, and they're trying to do Pilates to help them get better, and they're just struggling a little bit with this pain, sometimes people need a reason that can be treated in order to start allowing them to move and do their appropriate exercise and get better. So it's almost like the Pilates is going to get them better,
but then that didn't work.
So they just need a little, and this is where scar therapy is great, because I have patients who come having seen loads of physios for hip pain, have had injections, have had MRIs. we treat the scar because nobody else has ever looked at that before, and the pain goes, and then they can start moving better, and then it can stay away.
Yeah. And I've seen it. Working together, we've helped individuals kind of really get better by a couple of sessions.
Yeah.
Like they come to us, I do the posture assessment or somebody from the team, and I'm like, listen, we can help you, yeah, great, you can do Pilates, but if you really want the results, you probably want to do this or that, right? And then you're like, oh yeah, let's treat it. And then by the second, third sessions, I see them. Yeah. I see the way they're moving, and I'm like, oh my God, this is magic. Yeah. And they feel better, and they're motivated, because remember, pain obviously is not very comfortable, right? Like,
and it inhibits muscles, right?
It inhibits muscles. You're seeing no results. You're depressed. I'm putting all this effort. I'm seeing no changes. Yeah. Maybe I'm seeing, of course, you'll see some sort of changes, you know, because we work over all the body. But what you're really here for is, that core strength, that abdominal strength, and you're not seeing that. And that back pain is still okay. It's a little bit better, but it's still there.
In the background.
Yeah, exactly. Yeah. So what is it that I really need to do? And that's for us, honestly, at the studio, that's the missing piece that I'm always because nobody just comes to Pilates because before going to see, if they have pain, they've seen a physio. Yeah. Right? They've done sessions and sessions and all of that, right? It's not like they haven't done the initial homework. It's just that little missing piece, which is very important, that we're not aware of. No. I mean, and again, doctors, nothing against doctors, nothing against another physio, like nothing, but not everyone's trained on this,
and we're not informed. So
exactly.
For example, I absolutely love my oncologist and my surgeon. I had the best medical team looking after me. But when you've had cancer and the doctors have saved your life, they've saved your life. Yeah. Who really cares that you've got a scar? No one, because you're alive.
You're alive.
And you're thinking that, the medical team are thinking that. It's all about being alive. But actually, now as cancer rates are getting better and survival rates are getting higher, like, we need people to live. And actually, it's not just about, yes, you survived, that's great, but then the next step needs to be, okay, now we have this scar. You're not going to be happy with the appearance. You might not be happy with the function of it. What can we do? How can we help you? And it's not just oncology. It's after the C-sections, especially if it's been traumatic. People are like, okay, I'm safe, my baby's safe, and they just walk away, and no one's educating them actually. And there's three main reasons why people come and see me for scar therapy. One, they're not happy with the appearance. Okay, so a scar might be red, raised, puckered, pinned, or with the C-section have the overhang. Over in Dubai, this is probably the most popular reason why people come to see me.
The overhang, ladies, is that little bit that's hanging after a C-section.
That hangs over the C-section.
Beautiful scene.
Two, they come and see me because there's a problem with the function of the scar. So they've tried to return to exercise or movement, and they're getting pulling, restriction, irritation.
But that's probably a very, very low percentage, no?
And it's normally the people who are really in tune with their bodies, who have done a lot of sport before.
And that's a very small portion.
It's a very small percentage. And then the final group are the people who have got change in sensitivity. So they're in pain, or the numbness isn't going and that's panicking them, or they've got burning or itching. And again, there's maybe 20% of my patients are with pain. Most people come because they're not happy with the appearance, which is great because it gets them through the door. Yeah. Now, scar therapy will help with the appearance, but the most important thing is the function of the scar. As a physio, the thing I care most about is the function of your scar, and by improving the function of your scar, I will improve the appearance of your scar. Of course. But
so it's like the sub-product, the sub-product. It's my other world. Yeah. In my head.
I get what you mean.
But yeah, it just happens automatically after functionally you've gotten better. Yeah.
But I think we've got to work on awareness. And I think for women, because obviously it's really hard to know, have I got scar adhesions? Do I need, and not all scars need treatment. Like like we're saying, there's a high incidence of 95% of abdominal surgery will have scar adhesions.
Yeah.
So that's quite high.
Yeah.
But it's not everybody.
No.
Now, what can somebody look for that might imply that they have scar adhesions? If they're not getting any pain, which is not normally the case, normally it's not pain, it will be this pinning and sticking down of the scar.
Okay.
That is our clue that something is attached and pulling it in.
Can I like self-test myself?
Do you know,
It's
hard.
I
hard.
couldn't. Yeah.
It is really hard. And because the problem is, as soon as you stand up, we've tensioned the system.
Yeah.
So then already it's going to be tighter. So, which is why I assess people lying down. You should be able to move a scar. And when you are standing, the scar should be lying flat, not kind of pinching in or tucking in.
Okay.
So lying down, you can have a go at, can I actually move the scar? Does that feel quite free, like the skin is moving nicely, or is that really tense in some places? Or when you stand, is the scar sort of flat and on the surface, or are you getting bits that are pinning in?
Pinning.
These are your clues that actually,
Yeah.
let's get an assessment done to make sure that you don't develop these. And often the issues with scar adhesions, they're 5-10 years down the line. This is not a short-term issue. This is a long-term issue. So they're the kind of clues. But if you're not sure, you come for an assessment.
Yeah.
And if your scar is great, then great. I can just give you some general advice.
That's
We
it.
can do some movement and off you go.
Yeah, and you've done that. So some of my clients
Yeah.
are like, "You're okay," and I'm like, "Why are they okay?"
Not me.
Like, how are they okay? Because they move like this and they move like that.
Over to you.
Because yeah, exactly. Oh, back to me, and I'm like, "Oh my god."
It's not, I mean, there's often a scar involvement, but it's not always.
Yeah. No, I've seen that, and like, I mean, in my body there was a lot to work. Not a lot, but there was stuff to work on. And we will get to that. I want to talk about that because laparoscopic, we think, oh, it's not invasive, it doesn't damage things, but apparently it does, and we'll talk about this. But I stopped for safety reasons because I want to ask you questions that are on my phone, and the answer is going to be yes or no.
Oh,
that's it. Okay. I didn't send this to you.
This is a secret.
Okay, where are they now? Like, I need to find them. Okay, here. Yes or no? Okay. Is scar therapy painful?
No.
Can you work on a scar without touching it?
Yes.
Is it possible for a scar to impact your nervous system?
Yes.
Are there bodies that are too protected and you couldn't work with?
No.
Can body work affect my dreams? Just say yes.
Yes.
Okay.
I was going to say potentially.
Potentially would, probably, yeah. But no research on that.
No
Just
research on
hello,
that.
yeah. Can fascia remember my past injuries?
Probably yes.
Do you believe that everybody has at least one restriction in their body?
Yes.
At least one.
At least one.
At least one. That's for sure.
I'm sitting here today and I can't move my neck that way because I've hurt my neck. So it's just as well we're driving this way because I wouldn't be able to turn the other way.
Let's not go with, yeah. I mean, laparoscopic.
Okay.
It's very dear to my heart.
Yeah. So
just for the audience to know, just in case, and no, I mean, almost everybody knows that knows me. I've had a laparoscopic, actually one laparoscopic gastric sleeve, and at the same time, while they were doing the gastric sleeve, I had my gallbladder removed. So just tell them what you told me about that.
yeah, so any kind of keyhole surgery.
Yeah.
So even if we look at keyhole surgery in the knee, the incision is tiny. It's often one stitch. It's tiny. And so people will go, oh, I've had a laparoscopy, but look,
nothing.
My scars are this big. When they go in, they have to obviously insert a camera and the tools, and these are long and metal, and they are doing this kind of thing inside, okay? Because they have to perform the surgery and they're having a look around, which is what they need to do to check everything is good.
Of course.
But as they're doing this, they are moving through all the different layers of fascia, they are moving things around, they are causing inflammation, which we know is hard for the scar. The more inflammation there is, the harder it is for scar healing. So there's often a lot of trauma. It's a bit like the legs with the duck underwater paddling, right? It's that kind of thing. Like the surface, it looks fine.
It's
it all looks
beautiful.
beautiful.
Nothing.
Underneath, there's been quite a lot of disruption. So you must always consider what's been done underneath. And don't just think that because you have a tiny, which is the same with a C-section. Sometimes I get people and they go, oh, my C-section is perfect. And I look at it and I go, oh, well, lovely. It's straight line, it's faded, it looks beautiful. And then I try and move it and I can't move it.
Yeah.
So we can always be tricked by the surface. So yeah, laparoscopies often cause some deeper issues to the fascia, definitely. But can, through the inflammatory process, also have caused some scar adhesions.
Yeah.
So yeah.
Yeah.
Important.
And that's exactly what happened to me on the left side. So there was 3 incisions, and when we were working with this, the left side, it seems, never healed on any of the surgeries. I don't know what's wrong with my left side.
Healed. It did heal.
It did heal eventually, but not alone. It needed help. Exactly. I had a lot of
overhealed.
Yeah. I overdid it. Like I do everything. Yeah, it was, and it's amazing how, I mean, I lived years and years with this.
Yeah.
I mean, Pilates kind of gets you back into your body, and this is what I obviously love about Pilates and about our practice. It brings awareness to things that you don't even think about. Yeah. I mean, on Instagram, it's always like, I moved muscles that I never thought existed. And like, it's the thing, right? But in reality, it's what it's really doing is it's bringing that awareness of, oh, why does my left side act up when my right just didn't do that? And oh my God, how do I sit? And we talk to our clients obviously about it, and you know, we try to be like, okay, so I'm very guilty of this. When I'm on my laptop, I'll always put my right leg under my and I've been trying for years to break that pattern. I still do it every single day, and then when I'm conscious, I'm like, put that leg, and it's raised my hip, right? And it's amazing how, you know, how much work I now have to do to kind of rectify that over the years, but yes, it's a system. It's all of us trying to bring that awareness, like you said. I think, you know, and that's the whole point of this podcast, is to shed some light on things that we don't normally talk about. You know, I'm okay talking about my scars, but not everybody is.
No,
you know,
it's a real shame. And I think if there's been any trauma related to your scar and you're fearful of touch, then at the very least, a session of scar therapy is going to help you reconnect with that part of your body. And I often get people in sessions who, I haven't touched it, and I'm like, okay, well, are you okay with me touching it? We have to start around the area, slowly I can come onto the scar, and they'll just be crying, and it's bringing back the C-section that was the emergency when they thought they were going to lose the baby. I have people who I see for mastectomy scars, and they're crying because nobody's seen it, nobody's touched it, I feel so ugly. Like, there's all of these emotions linked, and if we don't release those, what are they doing, right? That's building up inside our body, causing other tension, things, causing other problems. And I think it's really, I mean, my scars on my tummy, I very much see as saved my life. So I like my scars. When I was in my skinnier days and wearing bikini, I would be like, let people stare. This is the scar that saved my life. And if people ever ask, I love telling my story because I think it's so important. Yeah. But lots of people aren't like that, and they're embarrassed and they're ashamed, and that's really sad, because at the end of the day,
a woman feels less woman, and it's all these complications. And
no, I've forgotten the word. I don't know if you saw on my Instagram the other day. There's a program in England called Towie.
No, I haven't seen that.
Made in Chelsea, and some of the characters from this Made in Chelsea, she's had lots of abdominal surgery. Okay. And she's doing a podcast with her, I think it's her husband, and I can't think of the word. It was something like kinasagi or something like that. It's a I think Chinese or Japanese word, and it means it's the process of when something breaks. So, for example, if they break a bowl, when you break a plate or a bowl, they repair it with gold leaf, because they're saying the repaired form is more beautiful than the original.
Actual.
And so he was talking to his wife saying, you're actually more beautiful now, because all of these scars have saved you, have made you the person you are have
today.
given you the strength to get through this, have made us closer. And I think that's just such a nice way. I will look up the word and get back to you, but it's such a nice way to look at it, because actually they are us, and they've all, at the end of the day, given us something good, because we're still here.
We're still here.
And they've given us a baby, they've saved our life, they've given us less pain. And I mean, if we can reframe that and actually
look at it different.
Yeah, look at it different, it's going to help us. It's going to help our healing, it's going to help our movement, it's going to help our emotions.
Yeah. And we're gonna live life embracing whatever has happened, because what's happened will I mean, it's prone to happen to everyone, and it's not like we just have to live that perfect life all the time.
No.
It's just who we are. Last questions before our batteries give up on us. One health advice that you will give to people, regardless, I mean, it doesn't have to be around scars. One health advice that you live by and would like to give to people.
No, don't go on what I live by.
Yeah, okay.
Because I very much do as I say, not as I do. Hydration. I think if we look at scars, if we look at bladder, if we look at function, brain function, we need to drink. And in this country, with the AC, we tend to not want to drink. So I'm really strict with my patients. You need to be getting in your 2 liters plus of water a day, and making sure that you're not then drinking too many bad things. Not too much caffeine, not too much alcohol, not too much fizzy, but really giving your body the water.
Laura, second camera is off.
It's died on us.
God, you know, we got to what we want to get.
We chatted.
We really want you guys to watch this. We want you to understand what she does, what's available to you, and what could help you with pain, with movement, with restrictions, with whatever, how it looks, etc. All the functions of your abdominals. Laura, so much. Thank you so much for this. I really appreciate it. It's a Saturday, 7 a.m. and when I said to Laura it's 7 a.m. she's like, are you serious?
My only lying. Although now, do you know where I've got to go? To football.
Oh God, yeah.
The kids have already started without me.
Have fun. No, but thank you for the time. I really appreciate it. I know how busy you are. But yeah.
Thank you for supporting women, men, and actually getting people to understand what's available to them, because it's people like you that spread the word that make a difference to people's lives. So thank you.
I really hope they watch it. I really, like, you know, the viewings, I'm like, the 7 a.m.s. Are you guys watching? But they're getting better, so that's good. No, but yeah, I'm on a mission. I don't care. Like, and you know me when I'm on a mission. I think people now know if Rima's on a mission, they're like, and whenever I say to my husband, I'm on a mission, he's like, oh God. No. Yeah. But
what so important, right? And it's the only way people know.
Yeah.
It's getting out there, talking
about it.
Yeah. I don't like myself on camera, but the only reason I do
to get her to do this was hard.
I hate myself on camera, but it's just about the more people that are aware. And people don't have to come and see me. Just go and see someone
wherever you are in the world.
Go and see someone who is specialized in this, who can help you.
Yeah.
That's just the message, right? Just get it checked.
Yeah. Thank you.
Thank you.